You know, when you think about cosmetic rejuvenation, we usually picture a very, surface level fix.
Right. Yeah, like a quick touch-up.
Exactly.
Yeah.
It's a lot like putting a fresh coat of paint on a wall in your house. You go in for, say, a facial laser treatment, your skin turns a little red, the collagen kind of tightens up as it heals, and, a week later you look refreshed.
Which is great because medical science understands exactly how facial skin responds to that heat. I mean, the dermal layers there are relatively predictable,
Yeah.
and the long-term effects of that specific thermal reaction, they've been studied for literally decades.
Right. But then you take that exact same concept using intense, highly focused thermal energy to essentially, burn or heat living tissue, and you apply it to one of the most sensitive, structurally complex, and hormonally responsive internal organs in the human body, the vagina.
Oh, yeah. And suddenly you are definitely not just painting a wall anymore.
No, not at all.
You are fundamentally altering a load-bearing, highly innervated mucous membrane. And you're doing it in an environment where, honestly, the medical community often doesn't actually know what happens to that structural foundation 5, 10, or, 15 years down the line.
Welcome to the deep dive. Today we are taking the massive stack of sources you sent us. So we've got medical journal articles, clinical trial data, and regulatory reports to decode the absolute explosion of something that is marketed everywhere as vaginal rejuvenation.
It's everywhere.
It really is. If you have paid any attention to aesthetics marketing lately, you've seen the ads, it is aggressively promoted as this quick, non-surgical, totally painless fix for basically everything from post-childbirth looseness to menopause symptoms.
Yeah, it's become this booming multi-million-dollar industry, but the medical reality underneath all those glossy brochures and perfect Instagram ads is incredibly complicated.
And controversial, right?
Highly controversial, in some cases genuinely dangerous.
Okay, let's unpack this. Our goal for this deep dive is to really look at the actual science of these machines, which the medical community called energy-based devices, or EBDs. We're going to explore the physiological mechanics of what they actually do to human tissue, why they triggered this massive international regulatory crackdown, and answer the crucial question at the absolute heart of this controversy.
Which is the lack of data.
Exactly. Why is long-term evidence so vital for vaginal tightening, and what does the lack of it actually mean for you? Helping me sort through all these FDA warnings and clinic claims is our resident expert, who is here to bring some objective logic to a very heated debate.
I am thrilled to dive into this. What's so fascinating here is that this topic sits right at the collision point of women's health, aggressive aesthetic marketing, and medical ethics.
Yeah, it's a huge intersection.
It really is. It forces us to examine the line between a genuine medical breakthrough and a potentially, dangerous cosmetic trend.
So, relying on the clinical reports in our source stack, let's just look at the hardware first. We see brand names constantly pushed by these clinics: Mona Lisa Touch, Thermiva, Empower RF. But mechanically speaking, what are these energy-based devices actually doing to the body?
Broadly speaking, the devices dominating this market fall into two main scientific camps. You have lasers and you have radiofrequency or RF devices.
Okay.
The laser camp primarily uses fractional CO2 or ERYAG lasers, which use light energy. The RF camp, on the other hand, uses electrical current to generate resistance and heat. But regardless of whether a clinic uses light or electricity, they share a singular core biological goal:
Which is what?
delivering thermal energy, meaning intense heat or microablation directly to the vaginal tissue.
And microablation basically means creating tiny, highly controlled injuries in the tissue, doesn't it? I mean, our sources describe it almost like pixelating the skin.
That is a brilliant way to visualize it. Let's take a fractional CO2 laser, for example. The clinician inserts a probe, and the laser delivers energy about half a millimeter deep into the vaginal skin.
Okay, so very shallow.
Very shallow. It creates these microscopic grid-like dots of damaged, vaporized tissue along the mucosal lining inside the vaginal canal. The underlying medical principle here is that this controlled damage triggers the body's natural wound healing cascade.
Because the body recognizes the burn and basically rushes emergency resources to fix it. Right?
Yes, exactly. The body immediately floods the area with immune cells and growth factors. This stimulates specialized cells called fibroblasts.
Fibroblasts, okay.
Yeah, they're basically the tiny factories in your tissue that produce new collagen and elastin fibers. It also triggers neovascularization, which is just the biological term for the growth of brand new blood vessels in that area.
Which naturally increases blood flow, sensitivity, and moisture. So on a cellular level, it's essentially the exact same process as facial laser resurfacing or skin tightening, just applied to the vaginal mucosa.
Conceptually, yes. The biological mechanism is identical. You trigger a controlled wound to force the body to firm up and rebuild the tissue.
I have to push back here, though,
Sure?
because looking through the historical data in our sources, CO2 lasers have been used safely in medicine, including heavily in gynecology, for things like removing precancerous cervical cells for like over 35
Oh,
years.
absolutely. They're a staple.
Right, they're not a new experimental technology.
Mhm.
So why is using them for vaginal tightening suddenly a massive problem that has international regulators issuing red alert warnings?
Right. So if we connect this to the bigger picture, the core issue isn't the laser technology itself. The laser is just a tool. The real issue is how and why these lasers are being marketed and deployed today.
Meaning who they're being sold to.
Exactly. To understand the controversy, you really have to draw a massive, thick line between treating a diagnosed medical condition and performing an elective cosmetic procedure.
Right, because looking at the medical side of our sources, conditions like genitourinary syndrome of menopause, or GSM, and vulvovaginal atrophy, they are devastating for the women experiencing them.
Truly devastating.
When estrogen levels plummet during menopause, the vaginal lining doesn't just get a little dry. It can become incredibly thin, fragile, and chronically inflamed. I mean, women experience severe pain during intercourse, frequent urinary tract infections, and just daily agonizing discomfort.
And that is a diagnosed physiological medical crisis. In those specific cases, using a laser to thicken that very superficial mucosal layer to stimulate those fibroblasts and bring blood flow back to starved tissue, that can actually provide profound medical relief.
Because you're treating an actual problem with the mucosa.
Yes, you are treating a disease of the mucosa with a mucosal treatment. It makes clinical sense.
But the clinical reality is that many of these med spas and clinics aren't just advertising to menopausal women with severe atrophy, are they?
Far from it. And that is exactly where the regulatory friction sparks. Clinics are aggressively using terms like vaginal rejuvenation, which, by the way, is purely a marketing term.
Right.
It holds absolutely zero scientific or medical definition.
Wow.
Yeah. So they are heavily marketing these powerful medical devices to younger women to, quote, tighten the vagina after childbirth or to achieve some idealized youthful aesthetic. They boast that it's painless, that there is zero downtime, and that you can hit the gym or have sex the very next day.
So they are taking a device that was originally cleared by regulators strictly for cutting or ablating soft tissue in general surgery,
Yeah.
and they're using it off-label to promise a designer cosmetic outcome for a highly complex organ.
Precisely. They are leveraging the legitimate medical clearance of the device to sell a simple cosmetic fix. But the reality of repeatedly burning internal tissue for aesthetic purposes is vastly more complex and risky than a lunchtime spa appointment.
And when you have an industry aggressively marketing a superficial tissue injury as a miracle cure for complex anatomical issues, it's only a matter of time before the government steps in.
Oh, inevitably.
And in July 2018, the US FDA released a safety communication that essentially dropped a bomb on the entire aesthetic gynecology industry.
It was an unprecedented move. The FDA commissioner at the time, Scott Gottlieb, issued a statement that was incredibly blunt for a regulatory body.
Right. Our notes show he specifically stated these devices were being deceptively marketed and carried serious risks. He even used the word egregious to describe how some clinics were preying on women who had survived breast cancer, promising them miracle cures without highlighting the severe risks.
Yeah, the FDA didn't just wake up and decide to ruin the party. They had been closely monitoring the MADI database. That's the Manufacturer and User Facility Device Experience database.
Right, where they track adverse events.
Exactly. This is where doctors and patients report adverse, harmful events related to medical devices, and the FDA was seeing a trend that genuinely alarmed them.
I want to look closely at those MOUD numbers, actually, because I've seen significant pushback from the medical device industry in our sources about this.
I'm sure you have.
Yeah. The manufacturers argue, look, out of thousands and thousands of these procedures performed globally, there were only about 45 or 46 adverse cases reported in the FDA's database around that time. Statistically, that is a microscopic percentage.
It is, on paper, but it goes beyond just the raw numbers. When you actually read those MIOD reports, the nature of the injuries is horrifying.
Like what?
These were not just reports of the laser failing to work or a patient feeling, disappointed with the cosmetic result. Women were reporting severe third-degree vaginal burns.
Oh my
They
gosh.
were reporting permanent scarring that ruined the elasticity of the tissue, recurring chronic pelvic pain, and severe dyspareunia.
Dyspareunia being excruciating pain during sexual intercourse, which is wildly tragic considering improved sexual function is exactly what many of these women were paying thousands of dollars to achieve in the first place.
It is a devastating irony. One clinical report detailed tissue fibrosis so severe that it physically shortened the patient's vaginal canal.
Seriously.
Yes. Another reported permanent nerve damage, resulting in total numbness and loss of sensation. I mean, these are catastrophic, life-altering outcomes for a patient's sexual health and psychological well-being. And because the MAMIU database relies largely on voluntary reporting, and let's be honest, many women are too embarrassed to report vaginal injuries, regulators heavily suspected those 45 cases were just the visible tip of a very large iceberg.
And this wasn't an isolated panic in the United States either. The global reaction was swift and severe. Australia's regulatory body, the TGA, looked at the exact same clinical evidence, and they didn't just issue a stern warning letter.
No, they went much further.
They completely canceled all energy-based devices intended for vaginal rejuvenation from their national registry. They wiped them off the map. You legally cannot sell or market them for that purpose in Australia.
Because regulators globally looked at the landscape and realized the marketing machine had wildly outcased the scientific method. You had highly powerful devices, cleared only for general soft tissue ablation, being wielded to fundamentally reshape the internal architecture of the vagina. And this was happening without any large-scale, peer-reviewed, long-term clinical trials proving it was actually safe to do so.
Here's where it gets really interesting, though. If you look at the websites of the clinics still offering these treatments, they quote these manufacturer-backed studies claiming 80 or 90% patient satisfaction rates. Patients are actively testifying that they feel tighter and have more moisture. So if a large cohort of women is saying the treatment works, why is the lack of long-term evidence the absolute hill these regulators are willing to die on? Why is long-term evidence so vital for vaginal tightening specifically?
That is the big question. To understand why regulators are so terrified of the long-term unknowns, we have to look closely at the physical anatomy of the pelvic floor and the insights in our sources from experts like Dr. Michael Lau. He's a specialized vaginal plastic surgeon. We discussed earlier that lasers and RF devices treat the superficial mucosal lining, right?
Yeah.
The energy penetrates, at most, maybe 0.5 millimeter.
Right. It is strictly a surface-level thermal reaction.
But vaginal laxity, that profound looseness and lack of support women often experience after enduring childbirth, is almost never just a problem with the surface lining. Childbirth causes catastrophic stretching and deep tears in the muscle and fascia.
Yeah, structural.
Highly structural. The heavy pelvic floor muscles themselves are physically separated. Applying a laser to the surface mucosal lining does absolutely nothing to reconnect or repair the deep, torn muscle fibers underneath.
It perfectly aligns with the driveway analogy from our notes.
Yeah.
Treating post-childbirth vaginal laxity with a surface laser is exactly like having a concrete driveway that is physically sinking, because the earthen foundation underneath it are cracked and unstable. If you try to fix that sinking driveway by just pouring a fresh, thin, beautiful layer of blacktop over the surface, it is going to look fantastic on day one.
It looks perfect. But the structural failure underneath hasn't been addressed at all. And this is exactly why long-term evidence is the crucial missing puzzle piece here. If we look at the short-term clinical studies tracking patients for up to 1 year, these devices do show a cosmetic improvement.
Right.
The thermal injury causes the surface tissue to swell with inflammation, it forces the creation of new collagen, and the patient genuinely feels tighter. But the medical community is asking, what happens to that tissue at year 2, year 3, or year 10?
Well, because the underlying muscle isn't supporting it, that artificially tightened superficial tissue just stretches right back out under the weight and stress of normal activity.
Right, inevitably. Without the surgical tightening of the underlying deep fascia and muscle layers, the superficial mucosal tightening will fade. The looseness returns.
Which leads to a really dark realization about the business model here. If the tightening fades after 12 or 18 months, do patients just keep going back to the med spa for more lasers? Do they just get put on an annual subscription plan for vaginal burns?
And that is the exact physiological danger that keeps regulators up at night. Without robust, long-term data tracking these specific off-label uses, We literally do not know the sequelae, the long-term medical consequences of repeatedly burning or heating vaginal tissue year after year.
Because every time you burn the tissue, you risk building up more scar tissue.
Yes,
Okay.
and scar tissue lacks the elasticity and blood flow of healthy tissue. Repeated thermal injuries could theoretically lead to compounding, permanent scarring, dense fibrosis, or cumulative nerve damage over a decade. You might successfully and temporarily shrink the tissue today, but if you do it 5 times over 10 years, you could permanently destroy the natural elasticity and innervation of the vagina. We just don't have the 5 or 10-year data to prove it is safe to do that. The industry is essentially flying blind, heavily relying on the placebo effect and short-term swelling.
That is genuinely terrifying. But in the interest of looking at all the sources you provided, this isn't entirely black and white, is it? The medical community is not a monolith, and not all medical professionals agree with the FDA's blanket warning.
Far from it. There is a massive, fiercely debated gray area. While most major medical societies generally support the FDA's call for more rigorous data, many highly respected clinicians felt the FDA's warning was a sledgehammer when a scalpel was needed.
Huh?
They argue the warning was too broad and actively harmed specific patient populations who legitimately need this technology.
To add to that, looking at the response from the Women's Health Clinic, or TWHC, in the UK, they take a very nuanced stance. They are a nurse-led medical clinic, and they completely supported the FDA's crackdown on deceptive marketing and non-medical practitioners wielding lasers in, like strip mall med spas.
Right, nobody wants that.
Exactly. But they heavily push back on the idea that the technology itself is inherently dangerous. They argue that CO2 lasers are incredibly safe and effective when used by actual urogynecology specialists who conduct proper medical screenings and deeply understand pelvic floor abnormalities.
And that nuanced perspective is strongly echoed by major authoritative groups like the American Urogynecologic Society, or AUGS, and the British Menopause Society. They recognize the danger of cosmetic abuse, but they are fighting to protect the medical utility of the devices.
This raises an important question. What happens to the patients who actually need this technology for severe medical conditions if it gets banned or regulated out of existence?
This is the absolute tragedy of the regulatory pendulum swinging too far. Think about breast cancer survivors. To save their lives, many of them are subjected to treatments that thrust them into early, sudden, and severe menopause. They suffer from agonizing vulvovaginal atrophy.
Right.
But because their specific cancers are often estrogen-driven, they cannot safely use traditional vaginal estrogen creams. The hormones could cause their cancer to return.
Oh, wow. So they are completely boxed out of the standard medical treatment.
Entirely. For those specific women, fractional CO2 lasers have been an absolute lifeline. And there's rigorous science backing this up. In our source stack, there is a landmark randomized clinical trial called the VEL-V trial.
Saw that.
Yeah, it was groundbreaking because it directly compared vaginal laser therapy to traditional vaginal estrogen therapy in postmenopausal women.
And looking at the parameters of the Velvet trial, it's fascinating. They took these women, split them into 2 groups. One got the laser, one got the estrogen, and evaluated them at the 6-month mark. And the data showed that the laser matched the estrogen therapy for symptom relief. Both groups saw similar, massive improvements in dryness, pain, and sexual function.
That parity is huge. It proves that in a controlled clinical setting, the laser is highly effective for mucosal atrophy. So for breast cancer survivors who cannot take hormones, completely banning these devices based on cosmetic abuses might deprive them of their only scientifically proven source of relief.
So how does the medical community bridge this gap? We have this incredible proven potential for medical relief for cancer survivors on one hand, and the terrifying unknown long-term risks of permanent scarring from cosmetic overuse on the other. How do we move forward?
The entire industry has to undergo a fundamental structural shift in how it measures success. We have to completely abandon subjective patient satisfaction scores.
Because they're too easily influenced.
Exactly. They are easily manipulated by aggressive marketing, short-term swelling, and the placebo effect. We have to move toward objective, biologically measurable science.
But how do you objectively measure something as complex as vaginal elasticity or moisture without relying on the patient just saying they feel better?
Well, medical science has actually developed highly specific clinical tools for this exact purpose. For example, our sources highlight the Vaginal Health Index, or VHI, and the Vulvar Health Index, VAI.
Okay.
These are standardized objective scoring systems. A clinician doesn't just ask how the patient feels, they physically measure the vaginal fluid volume, the pH levels, and the epithelial integrity, meaning how robust and structurally sound the cellular lining actually is.
It removes the emotion and the marketing from the equation entirely.
Exactly. And to address the deep structural issues, the long-term unknowns regulators are so worried about, we need to mandate the use of advanced imaging technologies. Things like high-frequency transperineal ultrasounds and 3D photogrammetry.
Bring it back to our earlier analogy. The ultrasound is essentially the ground-penetrating radar that tells us if the earth under the driveway is actually secure, rather than just looking at the fresh blacktop.
That is the perfect way to look at it. With a high-frequency transperineal ultrasound, a doctor doesn't have to guess. They can visually measure the dermal thickness, they can measure the exact distance to the deep fascia, and they can track the deep tissue architecture over time without invasive surgery.
Wow.
Yeah. If a med spa claims their laser permanently builds collagen and tightens the muscle, the ultrasound will objectively prove whether the deep tissue actually thickened and repaired itself, or if the surface mucosa just swelled up from inflammatory trauma and then quietly returned to baseline a year later.
So if we have the tools to actually look at the structural foundation, we don't have to guess anymore. We can prove what is medical science and what is just a temporary, expensive cosmetic illusion.
Exactly. Mandating the use of the VHI, VUICHI, and transperineal ultrasound in long-term, multi-year clinical trials is the only viable path forward. It is the only way to separate the genuine medical breakthroughs from the cosmetic snake oil.
We have covered a massive amount of ground today. Let's synthesize this. Energy-based devices, these lasers and radio frequency machines, they hold genuine scientifically proven promise for treating painful medical conditions like vaginal atrophy in the short term, especially for populations like breast cancer survivors who have no other options.
Absolutely.
But aggressively marketing them as a quick, off-label cosmetic fix for post-childbirth vaginal tightening ignores two massive realities: the total lack of long-term safety data and the actual deep muscular anatomy of the pelvic floor. The superficial burn simply does not fix the deep structural tear.
It doesn't.
So what does this all mean for you listening right now? It means you absolutely must be your own fierce advocate. If you walk into a med spa or a clinic and they offer you a laser treatment for vaginal laxity without a comprehensive physical exam by a qualified urogynecologist to check your deep pelvic floor muscles, walk away.
Yep.
If they promise you permanent tightening without explicitly detailing the long-term risks of scarring, or the fact that you might need expensive repeat treatments indefinitely to maintain the swelling, walk away.
I would leave you with this final, broader thought to consider, something that goes beyond just the medical devices themselves.
With that.
What happens when our modern social media algorithms, which are mathematically designed to prey on our insecurities, start accelerating this specific type of off-label aesthetic marketing? We are rapidly moving into a world where viral trends and influencer marketing dictate what is considered a normal aging process for highly sensitive internal organs, often before the decade-long clinical trials even finish recruiting patients.
That's a scary thought.
It is. As these algorithms blur the line between healthcare and beauty standards, how much of the heavy burden of proof is quietly shifting onto you, the patient, to decipher the difference between a fleeting, algorithm-driven cosmetic trend and a scientifically validated medical reality?
It is an incredibly heavy burden to carry, and it brings us right back to our house.
Yeah.
Before you let anyone apply that expensive, high-tech coat of paint, you better make absolutely sure they know how to inspect the foundation.